I'm Micah Weidner, and I am 18 years old, and I'm here to talk about my cardiac arrest in 2020. About 3 years now, I was actually just in my room, 15-year-old, perfectly healthy, and then out of nowhere I just kind of collapsed on the floor. I had cardiac arrest. Like about 2 minutes after my cardiac arrest began, my brother just came in, and if he hadn't come in right there, it would have gone a much different way. But thankfully he came in, and he was only 12 years old at the time, but he knew CPR. And because of that, he actually was able to keep my heart beating, and he called my dad in. 911 was called, and after about like 11 minutes, my heart started beating again. And then I woke up in the hospital.
The pediatric calls are the worst, right? The kids hit us the hardest. As a father of 3 kids, like that call is always the hardest. In the moment, you're not thinking about it, right? In the moment, you're doing all your training, you kind of get locked into that automatic mode of, hey, I'm caring for this patient, I'm getting things taken care of. It's the after effect that it really hits you.
So really the Race to the Top program started around this idea that what gets measured gets better, and we've started to incrementalize first our measurements, and then our improvements, and then the pieces that needed to come next. And it was all about reducing the variability in the approach to a cardiac arrest patient to begin with. We ultimately have to jump into approaching the patient the same way every single time to make sure we're establishing really good perfusion in order for us to get the results that we've increased and improved.
So every week we meet on all of our cardiac arrests, pull data from what went well, what maybe not so well, and we use that as our guiding force for education. So for example, if we're really struggling with placing the Lucas, we will focus more on that when we're in the classroom so that we can kind of correct those issues that we're seeing in the field. And it also focuses on what went really well in our cardiac arrests. We like to praise our employees and show recognition for the things that we're doing excellent.
Early in my career, the first 10 to 15 years, we celebrated when we had 1 or 2 survivors a year. And this last year, we're over 20. And it's attributed to the staff on the Peoria Fire Department, the staff at AMT, and those efforts to improve the care that we provide to these cardiac arrest victims and get them healthy enough to where they're discharged and walking back out of the hospital.
I've been in healthcare for almost 18 years, and we measure a lot of things and we talk about how we can improve, but this is an area that not only are we improving locally, but we're helping to set the pace for some national benchmarks and some national improvement in care. We're taking what we're learning in Peoria and we're sharing that with teams of best practice clinicians and researchers to show what areas we have success in, and then retrospectively we're able to work with those teams of providers to identify areas where we may be able to make some improvements in our processes.
It requires buy-in, honestly. You can bring forward what you envision as the best program, and at the end of the day, the paramedics from AMT and the firefighters from the Peoria Fire Department, they all have to buy into the concept, and I could not be any more proud of them. And on top of that, to see that collective partnership and to see the education and the work and all of that working together to the benefit of the Peoria community, I couldn't be any more proud.
I think we're fortunate, blessed, in fact, to have the people engaged in the leadership of Race to the Top today, Lauren and Brett in particular, keeping their nose to the grindstone, saying never give up, ever. And it's meaningful. It's changing outcomes in ways that even I couldn't fathom. I mean, you're talking about protocols, quality improvement, talking about what works, talking about the quality of the resuscitation effort as measured by our new cardiac monitors. All of those things, I think, are contributing factors to where we are, being almost at 3 times the national average.
We cannot over-exaggerate how important it is that people do bystander CPR. What we do in the field is always going to be negligible in comparison to a patient that has already had hands-only CPR started prior to our arrival. It is at least 60 to 70% higher outcome for those patients.
So this Race to the Top program, not only is it a collaborative effort with the fire department, the police department, and the hospitals, but it's also a collaborative effort with the public and the community that we serve. They probably play the most important component of early recognition early CPR and early AED access.
I think the fact that my brother knew CPR was probably the biggest deciding factor in what happened. And the fact that I came out of that in a way which is like totally fine, no brain damage, nothing like that, shows that that kind of thing is possible. And one of the biggest things that I would want for the future is for every single person to know CPR. Cardiac arrests can hit anybody at any time, and one of the best ways that we can minimize the damage that they cause is to learn CPR and learn how to use AEDs. If we learn those two things, then we can save a lot of lives.